Well, we do, as you know. I mean, the big news is that Texas has had locally mosquito vector transmitted Zika viral disease in the lower Rio Grande Valley. Right now, even though we've had a relatively warm winter, the weather has cooled enough that the mosquito activity is decreasing. So we are, though, very much trying to plan for a different scenario, if you will, in 2017 than we saw in 2016. In other words, we know that Zika is already in Texas communities, and we don't necessarily think that that's going to stop. So that this coming season, there's a very good chance that we will have sustained Zika transmission within Texas communities. And so all of our planning is really around how to do that. So for instance, laboratory capacity. DSHS has a certain laboratory capacity, but other labs around the state have capacity to do certain types of testing for Zika. The other is our disease investigation. So when we have a case of Zika, we go out and ask questions about that may help us understand, was it acquired locally, was it acquired sexually, was it acquired during travel, for instance, and then we have to coordinate that with vector management. We have been very much engaged all along in communication with the CDC and with our local health departments that are really at the front line. And so I think in this case, unlike, for instance, Ebola, where it really kind of surprised everyone that suddenly it's here, we've been forewarned and we've been planning for a very long time to how best to coordinate that effort. So the CDC is very engaged with us. They listen to us. They take our perspective on the disease problem very seriously and help us work out models of what the disease transmission might look like and what the best kind of response may be. So I'm happy to say, in a sense, that our conversations with CDC in Texas and our locals really are putting the entire science of Zika response, we're at the cutting edge of that. So CDC is there. It can offer us expertise. It can offer us certain types of resources, if you will, including personnel. We had, for instance, a vector control expert from CDC come and visit the lower Rio Grande Valley and go around with the vector control folks there. So they have a real clear vision of what challenges there are in those areas. And then we will also work very closely with our county and city health departments. We all realize that the one thing that we have to do is communicate very, very clearly and effectively. So we make sure that everybody has the same facts available to them and that everybody arrives at a consensus of what are we looking at? What is the situation? Are we really dealing with local vector transmission, for example? And then we direct our response resources accordingly.
Great.
Chairman.
Yeah, Representative Guerra.
I don't mean to belabor it because I assume we're going to be hearing a lot about this as the session moves on. But it's very apparent that part of the problem here is the breeding grounds for these mosquitoes, as opposed to just testing. It begs the question: is there been a tremendous amount of have you been encouraging not only counties but cities to make sure and let the public understand that dumping stagnant water is very, very important? As I drive around the state sometimes, especially in the valley, you see all these properties with tires just sitting out there. I assume that we're really being very proactive with that because I think that will be a tremendous help in this area. But I didn't mean to expand on that, but I'm very concerned about that issue.
I'm very concerned as well because basically what you're talking about is behavior change and behavior change on a rather large scale. So people going out and making those changes on their properties and that sort of thing. We have efforts at education. We have efforts at public outreach. I would love to work with any kind of local leader as well. Particularly, in my opinion, we have not tapped the potential of local community organizations that know the neighborhoods that they're working in and can go knock on doors and provide face-to-face communication and hopefully motivation to change.
Yes, Representative Collier.
Thank you, Mr. Chairman. Commissioner, I just want to commend you because I felt like when we first had the original outbreak and when it came here, you were very concerned about it and you took a proactive approach towards it. And so it could have been worse. And so I want to commend you and your department of what you did in educating and making sure people know a little bit more about the condition, the virus and how it spread and so forth. But I do have a question, and I don't know if it's under your purview, but are you doing any research to figure out how it's transmitted, or are you relying on the CDC? Or are you doing any research to determine what are the best methods to reduce the transmission?
That's a great question, and it does kind of fall into two areas. So the real basic science research is being conducted by CDC as well as many other academic institutions that do research for what they do. From our standpoint, though, we are working closely with CDC, for instance, to say, are there innovative ways of doing vector control that we really ought to think very seriously about investing in. I think folks are really very well attuned to the multi-phased approach that is necessary for the optimal control of Zika. So we have a number of countermeasures, if you will. So people can wear long clothing, they can wear insect repellent, they can go out in their property and get rid of small areas of standing water. Communities can do the same kind of thing. There's vector control in the form of larvicide, killing the larva and killing the adults. No one of those is really going to be adequate to completely control. And so it's a matter of how do you motivate in communities to take action across a very broad range of behaviors that they can undertake to reduce this threat.
Okay, thank you. I'll work with you any way I can.
Absolutely. Thank you.
Representative Oliverson.
Thank you, Mr. Chairman. Commissioner, I appreciate your report. I was kind of waiting to the end to ask my question, but as I'm going to have to leave in a couple minutes to go to my other hearing, I wanted to not miss the opportunity to ask you. I wanted to talk briefly about data security. You do collect a lot of information, health information, as we know, under federal law is protected information. And I just wondered if you could speak a little bit about the steps that your department takes to make sure that the data that you're collecting on individuals and families, how protected is it? Have you had any data breaches? And kind of what do you do to secure people's information?
I am not a technical expert on that regard. I am not aware of any serious data breaches that have taken place. And you're right, we absolutely take that information and keep it secure. For instance, if we are ever to share information with researchers, which they have to go through an institutional review board in order to obtain the information that we provide to them is completely de-identified. So we never give out any information that has a specific patient identifier information in it. And in fact, at a certain level, we're not even allowed to share that with our sister agencies in certain instances.
Okay, appreciate it. Thank you, Mr. Chairman.
You bet. Thank you.